Okay, so we have an update. We had our regular doctor's appointment today. They decided with whatever they're seeing, a mass in my lung rib area. It does have some fluid on it, so just gonna put me on some antibiotics as a precaution. Run a course of antibiotics. They don't know what it is. I think it's a pulled muscle, and she wasn't really in disagreement with that. She didn't know how to describe it. Don't know what that thing is, but something is there. It's some kind of injury or something, and it has fluid on it. So that makes perfect sense to me. It's definitely an injury. So if it could have gotten infected, sure, why not? I mean, a broken bone can get infected, so why not? And then my tumor markers on my regular update or doctor appointment, my tumor markers are down to just over 100. They're down really low, and they started at about 450 when I started the study. So my tumor markers were really high, and they've come down really far. So that is wonderful. And what is a little bit strange is that she said the mass in my side that has grown before and then receded, it has grown again a few millimeters. She doesn't know why. They're going to increase one of the medications that I'm on. I had been on an increased dose of it, and this was the secondary medication, not the primary medication. So it's not even the medication, it's a genetic match. But they're going to put me on that medication at the higher dose again and try and see if that helps it stay stable. And then what she said was she didn't feel at this time that we need to look at changing course. So what it may hold in the future, don't know. Obviously, nobody knows. Only God knows. None of us know. So that wasn't the best, but it was good. Callie had a really good perspective on it because it had shrunk in centimeters, and it's only grown back in millimeters, so that's really good. And that is true. It's nowhere near like the size. I mean, I can feel it, and it's nowhere near the size it was before. So I'm also wondering if I could have like worn clothes that irritate it and make it feel worse or cause it to be inflamed, because it's right kind of above my waistline, where if I wear something that's on my waistline, which I need to do a lot because I'm so cold all the time, I'm so cold all the time that I layer up and wear tights, but the like under, what do you call them? Base layer, like warm, actual warmth kind of clothes.
Dress.
Right, and then sweatpants on top of it, and then a dress over it. So very,
and a sweater and a jacket. And
right,
a
right. So I mean, like have undergarments and then multiple garment layers on top of it. So yeah, it could easily be irritating it. So maybe I can do some things to bring that down as well. So overall, good. we didn't get kicked off treatment. So that's a good day. We get to continue forward, and I do have to stop to do 5 days of antibiotics. I have to stop all treatment while I'm doing the antibiotics, and then I'll get to start again, resume as soon as the antibiotics are done. So
Yeah, that's about it.
that's about it. A good update. Thank you for the prayers, for the many, many prayers.